Hi guys, here's how to perform a PICC line dressing change. So an important thing to remember is that PICC lines, the dressing change needs to be sterile because a PICC, the tip of it is in the superior vena cava of the heart, so there's a higher risk of infection and complications with it than a peripheral line. So the first thing you do is you're gonna obtain a central line dressing change kit. You're gonna need the bio patch, which are just the protective discs that kind of limit the risk of infection. I usually grab 2 because sometimes they're a little pain to open and I usually drop them. And clean gloves. Sterile gloves come in the kit. And then since it's COVID times, you already have a mask on, but the patient's also gonna need a mask, which comes in the kit, usually. But make sure you grab an extra just in case. So first I'm gonna wash my hands and then I'm gonna put on my gloves. Make sure you explain to the patient the procedure. Try to have the patient tilt their head away so they're not right over the site. If they have their mask on, it's usually okay, but it's better to be safer. So I'm gonna put my clean gloves on and I'm gonna open up my central line kit. So remember that this kit is sterile. So with clean gloves, I'm just gonna only touch the mask and grab it. And then this mask, you're going to put on the patient. So on my patient. And then I'm also going to just grab the sterile gloves out. So I'm gonna take the bio patch and drop it into the sterile field, so I'm not gonna touch it at all. I'm just gonna simply drop it into the sterile field. So I'm gonna open up the bio patch and without touching it, I'm gonna drop it into the sterile field and throw that away. So with my clean gloves, I'm going to undo this dressing, the dirty dressing. And be careful to not pull it off because you could pull out the catheter and then it won't be in the right place. So do it very gently. Especially you don't want to be ripping tape off people. It's not the nicest thing to do. And you'll have some very unhappy patients. It's a lot easier to get off a real person than the mannequins too. So once you took off the dressing, the dirty one, throw the dirty dressing away. And then I take off my clean gloves. And then I'm going to start putting on my sterile gloves. So with my sterile gloves, the outside is completely unsterile, but the inside is. So open them up. And makeshift it any way you can. And if you ever break sterile fields, I usually bring an extra pair of sterile gloves in case and an extra kit because it's always better to have it and not need it than need it and not have it. So now I'm sterile. So I can touch the inside because the inside is less sterile and just toss it away. And then what I'm going to do is I can now touch everything in my kit. So in these kits, there's drapes, which you really don't need. But I don't use them. There is a chlorhexidine wash that you use to wash around the line. Tape if you need extra tape. Gauze that you could use to hold the line, or you can also use these tweezers. And there's also a cotton swab if you need to kind of get under the line, but I also don't use the cotton swab. So the first thing I'm gonna do is clean around the PICC line. So for this, you just break it, squeezing the two, and then it will come out. I use these so I don't contaminate any of my gloves to kind of pick up the line and hold it. And then I wash around the line, down the line, all around it. You can even wash under it. And then I throw this away. And then this is also, the tip's not sterile either. So I also toss this away because I don't need it anymore. I already cleaned under the line. Then you wait for that to dry on the patient, because if you try to put the Tegaderm on it now, it's not going to stick very well. You also have to remember to put the bio patch on before. So I usually split it like that, and that's what goes under the line. So this part gets a little tricky. So I use the gauze to hold up the line and then circle that around it so that I don't contaminate myself either. And then you can also use the gauze to push it into place. And then the gauze, toss that. So my hands are still sterile, so I can still touch all of this. Next, once that's dry, the mannequins, it takes a little longer to dry than actual humans. I'm gonna get my Tegaderm dressing ready. So, pull the back off, and then, super sticky, place it on. Mannequin. Make sure it's nice and secure. And then you can start removing the white around it. That. Right. And then I just assess to make sure that it's on. Right, everything's covered that needs to be. And then on this, take this aspect on, and you want to label it with your initials, the date, and then the time of the dressing change, so that the nurses who are after you, who have this patient, know when this dressing was done. And then slap that on. Make sure you do it on the table before you put it on the patient, because you don't want to be writing on the patient. Once the dressing's on, your hands aren't really sterile anymore, so you can touch whatever you want. Now you just clean up, and that's it.